Hello, hello. So thanks for joining me this morning. Yeah, this field that we're in does have an impact on us, and for a long time I've been doing trauma work and recognizing how that impacts the nervous system of the clients that I work with. But it also has a massive impact on us, and so we're going to talk a little bit about that. We don't have a lot of time, but just kind of an overview of kind of what I expect to be happening to me throughout the day and things that I can do to take care of myself. I think that, let's see, there we go. Yeah, so the idea that we can be hearing stories and getting the download on horrific events and not have it impact us is as unrealistic as this quote says. Unrealistic is expecting to be able to walk through water without getting wet. I think no matter what boundaries we have set up, if we're doing our job, our nervous systems are going to, on some level, take on the trauma that others are sharing with us. I think if we're not doing that, we're probably not being that effective. I really like to, let my nervous system meet the nervous system of the other person. I try not to merge, but, our mirror neurons are pinging off of each other, and so we are going to experience some of that trauma. Boundaries are really important, but we're all going to have those clients that touch us, and even at the end of the day, if I go out and try to shake off of it, some of it's going to stick, especially if we're dealing with, some of the worst atrocities that that people can inflict on each other. So having almost ritualistic or habitual self-care strategies is really important. One of my colleagues here at Tucson is Native American, and one of her self-care strategies is at the end of the day, she'll go out to what we call the cholla cactus here, and in her belief system, the cholla can grab onto negative energy, and she'll actually blow onto the cactus and let some of that negative energy go, and that's part of her healing strategies. Other people, it's going for a run, or I know another colleague who will put her hand on a rock at the end of the day to discharge some of that energy. Humor is a great way to deal with distress, and so throughout this presentation I'm going to throw up a couple slides, but again, if we care, we're going to be impacted, and sometimes caring at work leaves me unable to care as much at home. That's one of the impacts. So goals for today, we're going to be whipping through these slides, but looking at how our work impacts our lives, understanding what compassion fatigue is, vicarious trauma, burnout, secondary traumatic stress, and then what can you do? When I've done this presentation before, I've done it as a couple-hour training, and one of the things that's really interesting is looking at and asking you, how does this work impact our lives? There's a lot of it, a lot of the work, the impacts are positive, a sense of worth, validity, some altruism, maybe, some hopefully putting some karma bucks into our coffer. But what we're trying to do is reduce the negative impacts, and some of them are given. I know that there's been times when I've canceled a workout or canceled a date night with my wife because I'm dealing with a client in crisis. Sometimes I'll lose sleep over someone I'm concerned about, some suicidal ideation. Sometimes, hearing something really horrific does affect my appetite or does affect tension in my shoulders. I know when my daughter was a teenager, sometimes coming home, and I remember her first romantic breakup, I came home and she was struggling with that, and I was, had to dig pretty deep because I was pretty emotionally tapped out. So it's clear that this work does impact our lives, and again, we're going to come back and talk about some things that we can do to mitigate that. Some data from the field, 40 to 85% of helping professionals develop vicarious trauma, right? all these references are at the end of the PowerPoint. If you're interested in that, just let Courtney know and she can send it out to you. But again, we see that this work does impact us. Social workers exhibited symptoms of secondary traumatic stress. Sexual assault. If you're working as a counselor or therapist, maybe dealing with less heavy content, it may not have as much impact. I know there's certain clients, I know that if I'm seeing this person, it's going to be pretty heavy, and so I try to schedule those people in the morning when I'm a little bit fresher. Dealing with sexual assault, sexual abuse, domestic violence, that can be more unsettling than dealing with someone who is kind of struggling with a mild existential crisis. In my private practice, I was seeing an individual who, wanted to explore the meaning of life, and that was kind of fun, a little banter, talking about archetypes and kind of those existential, questions, talking about philosophy, and that was enjoyable and not so heavy as dealing with the person who's having the intrusive dreams that they weren't even aware of. That maybe their daughter turned 7 and that's when they were abused, and so all of a sudden this heavy-duty content comes up. So the type of therapy and the content that we're dealing with is going to have an impact on us. So let's jump into some of these terms. Secondary traumatic stress, bearing witness. And when I talk about bearing witness to a traumatic event, that's actually hearing it. And so when that trauma gets internalized, it can mimic the same symptoms of post-traumatic stress disorder. Usually, as a therapist, as opposed to us getting overactivated, it's more of the hypomania, where there's actually more of a shutdown and we feel a little bit numbed out. I know that if I'm, dealing with someone who was assaulted in a parking lot, when I get out and if I'm in a grocery store or a parking lot, I'll be like, wow, there are threats. So we can become a little bit more vigilant, difficulty sleeping. It's funny, I know this work definitely impacts my sleep, and I have this Fitbit here that monitors my sleep. And I know there's age, but I had to change my sleep goal because I wasn't reaching. I had to go from 7 hours to 6.5 because I wanted to be able to reach my goal at least sometimes. But I definitely know that if I've had a pretty heavy, high content, high activation day, it does affect my sleep, it affects my appetite, and it also affects my motivation into how I meet the next client that day, and that feeds into the term vicarious trauma. And vicarious trauma is not a single incident of secondary trauma, it's a cumulative effect. It's where our worldview can change, and it's as I said, it's cumulative. So it's not a single event, it's one event piled on top of the other, and with that can come a loss of empathy, a loss of hope. You toss that in with this term burnout, which we'll explore a little bit more, and we get this term compassion fatigue. So burnout is the workplace. It's where perceived work demands outweigh perceived resources. So we got too much going on, and we've all experienced that. With vicarious trauma, it can sometimes just having a weekend or a 3-day or 4-day weekend off isn't going to be enough. So we can turn down the volume a little bit on it, but sometimes, we like, for example, we know with depression causes change in brain chemistry, and over time, people can actually have a cognitive decline. Well, with vicarious trauma, we let it go on too far. To reverse it or to get better can take some serious time. We'll be talking about the effects of these in a minute, but I'm sure some of you out there have experienced this vicarious trauma or the secondary traumatic stress, where we're hearing a lot of intense stories and narratives, and how does that affect not only your nervous system, but your somatic system as well. Aches and pains, autoimmune issues can occur. When we're getting that cortisol dumping into our system, and most of the people don't come to therapy because things are going really well. Most of the time, I don't know if they're ever coming to therapy if they're feeling really well. Usually, if they're doing really well, then that's when we say, treatment complete. So we're not in the happy, joy business. In the world of somatic experiencing, we oftentimes help people tap into the positives as well, which can be really beneficial. So we call that sometimes going into the blue. The red is the trauma, but with somatic experiencing, which is one of my preferred treatment modalities, we actually encourage people to focus sometimes on the positives. So again, compassion fatigue is vicarious trauma and burnout combined. The emotional residue of the stories and experience that we get from hearing people, hearing their stories. We're hearing pain, fear, and terror. So even though we're not experiencing it, but we're hearing it, it does have the big impact. And that's, that's one of the things I want you to take away, and to, for us to recognize that it's part of the job that we're assigned to do. I love the fact that the World Health Organization recently classified workplace burnout as an occupational phenomenon. I'm going to change my screen a little bit. Okay. As an occupational phenomenon and consequently a work hazard, right? It's interesting that the more successful we are, the harder we work. In the traditional culture, 30 hours a week, 25, 30 hours a week is what someone was doing to survive, and the rest of the time was spent working on survival or ritual, sex, play. But in our culture, the more we work and the more successful we are, oftentimes the more we work. And so we're going to be doing the dance between, just enough and burnout, and kind of riding that edge all the time. I think that's kind of us being geared for success, and I don't know. I know for me, it's like I need to have that sense of worth, and so sometimes if I'm feeling energized, I'll take on another client when maybe I shouldn't. Sometimes what's possible is not necessarily what's optimal. So let me do, whoops. So predictive factors of burnout, large caseloads, internal politics, right? I spent my first career, I was a teacher, and talk about a burnout profession due to the politics and bureaucracy. If any of you out there have been in the teaching profession, I think that's some of the most dysfunctional bureaucracies that I've ever experienced, and that feeds in the lack of control. I want to go down to the bottom, that difficulty with work-life balance. That is probably one of the biggest things. We tend to engage in self-care when we're doing pretty well, when we're feeling happy and joy. That's when we go to yoga. That's when I appreciate my life, and my life is in balance. And when my life's out of balance, that's actually when I stop doing some of the self-care mechanisms that I really need to engage in. I stopped eating as healthy. I was listening to David Goggins. I can't remember his book, Can't Hurt Me, and he was talking about these self-care strategies shouldn't be. You shouldn't do them when you're motivated. You should be doing them all the time. They should become habits. And so when we're working more, when we are struggling with a large caseload, that's when we really need to bring in these elements of self-care instead of pushing them aside. We shouldn't be skipping lunch. We should be really taking those time to meditate. Potentially having a yoga mat in your office, Again, my Fitbit tells me that I should take 250 steps every hour. And so, if I'm dealing with the challenging clients, I'll blow that off. But that's something that we really need to be working on to take care of ourselves. So who's at the greatest risk for compassion fatigue? If you are good at your job, you're going to be more empathetic, and so you're going to be at greater risk for compassion fatigue. Really engaging and meeting that other person's nervous system, some of that is going to bleed off on you. If you don't see self-care as a priority, right? Again, that needs to be a primary component, right? And we know that trauma is cumulative, so people who've had childhood trauma are more susceptible to having an event be perceived as traumatic later in life. So if you have a personal history of trauma, that is going to be set your nervous system up to go 0 to 60 or 0 to 30 more quickly. I know that I used to do a talk, I still do it, on trauma-informed care, and when they've looked at the Vietnam vets and people who've come back from a war and have PTSD, oftentimes those people's nervous system was primed, or in SE they call it coupled, for activation. And so, Peter Levine talks about trauma not being so much in the event, but how our nervous system interprets that event, and our own personal resilience. I mentioned this, that compassion fatigue results in a loss in empathy, hope, and compassion, right? And the key word is the gradual erosion that keeps us connected. We know that the ventral vagal and connection with others is really important. And when we start to experience this compassion fatigue and burnout, then we tend to isolate, which can be the negative feedback loop and cause us to go down the rabbit hole. And sometimes, again, I'll come back to the depression analogy. If once we go down to a certain level, it can be hard to get out. It's like if you're digging a hole, eventually you can keep throwing the dirt out and you can kind of be stuck there. And so, reaching out to others for that connection and support and having a healthy support system is vital. So, compassion fatigue is broken down into 3 categories: intrusive symptoms, avoidance, and arousal, or what I like to call somatic symptoms. So intrusion is, if I'm dealing with a client who had a lot of religious abuse, I'm going home, I'm thinking about that, and that is going to impact my spiritual practice. It might be intrusion in my sleep. I might be waking up thinking about someone. Not being able to let it go. Following up, if I'm seeing someone in my work at Tucson, I might be calling up the nurses at night when I should be at home and saying, how's so-and-so doing? Can you check up on them? Avoidance can be, how do I get away from the work? And that can be have negative connotations. It can be I'm avoiding the thoughts through maybe through drinking, through drugs, through TV. Am I avoiding the content in that next session? Right? Sometimes it's like, whoa, I'm feeling really overwhelmed, and someone drops the cue about a really dysfunctional relationship. I haven't seen Uncle John since in the last 10 years, and in me going, I get the kind of gut feeling in that session, but I'm a little bit overtaxed, and I decide not to go there, right? So I know that if I'm fresh and feeling alive and invigorated, I'm more willing to play the sleuth a little bit more effectively than if I'm burnt out, and I'm using burnt out in terms of compassion fatigue. Somatic symptoms, these are the stress in the belly, the tension in the shoulders, the migraine headaches, the pains in our joints. Back to avoidance, if I'm hearing again these crazy, really horrific sexual abuse stories, that may impact my patterns of intimacy. But the somatic symptoms, I think, are really interesting, in terms of the vicarious trauma and how that impacts really what's going on physiologically. The other hazard of this work is sitting down for long periods of time. So again, habits of self-care, getting up and moving a little bit. But and as you're sitting out there and watching this, you might think about what somatic symptoms how your work is showing up in your own somatic ailments, right? We know that depression and fatigue impacts our immune system, and working long hours and hearing lots of horrific stories is probably impacting your physical health. I'm not going to talk about coronavirus right now, but I think and we may have a minute at the end to talk about that, how that impacts our work. So why are we here? I love my job, right? We talk about the negative, but the positives. We get pleasure and satisfaction. I love who I work with. I'm showing up in the world. I have a mission statement about reducing suffering. I'm in line with my mission statement. So that's a resilient piece that we can tap into. Just a little sidebar, there's this awesome phone app. If you Google Provider Resilience, it's Android or on iPhones. My executive director of here Tucson, Jamie Vink, turned me onto this. It's kind of a fun little, I don't know, but give you some insight, some great questions that it asks. The fifth one down, I'm happy that I chose to do this work. Likert scale, most of the time I'm rating a 4 or 5. Last question, I feel trapped in my job. I remember at one point I did feel totally trapped. And instead of playing the victim card, which is one of the things that we need to be self-challenging, recognizing what can we do to change our state of mind. So I want to jump into resiliency. I got about another minute. I'm going to jump into some things that we can do. Self-regulation, how do you relax? Lots of self-care strategies, orientation, looking around the room, especially when I'm doing EMDR. I can stay present. Intentionality, some of that youthful idealism, tapping into that. You are a professional. Why do we do this? Confronting yourself, having others that can confront you. My wife's a great one. Tells me, Chris, quit your moaning. You got this awesome job. Self-care, right? We want to dive into that full on exercise, yoga, meditation, because we don't want to be burning out like this. Organizational interventions. What is if you're working for a healthcare system, how are they supporting the employees? We have a thing called the Sierra Tucson store where we can actually get toilet paper and cheese and tortillas, because some of us work really long hours, and going from here to home doesn't allow time to go into the Corona Fest at the grocery store. So that's, I want to shout out to Sierra Tucson and again Jamie for providing that. We ask our clients, is it working for you? I always say there's only one answer to that. I do that all the time with myself and can confront the victim thinking. Again, normally this is a 1.5 to 3 hour presentation. I want to thank you all for showing up. Again, a little bit of humor. It's the new antidepressant. Instead of swallowing, you throw it at anyone who appears to be having a good time. Misery loves company. It's sometimes if you're feeling down, we don't want to be around someone who's feeling up. Anytime you can bring humor into the equation, it's a good thing. So I want to go to questions. How does using Zoom affect compassion fatigue? That's a great question. I don't know. At first, I was a little bit afraid of using Zoom. I know for me, it's actually helpful because I can put on a nice shirt and be sitting in, flip-flops and gym shorts. I know I do miss out on some of the cues. I think for residents or clients, it can be sometimes easier because they don't need to navigate the outside world. They can stay home. They don't need to necessarily find a ride or get perhaps have healthcare is dialed in. So it may be making it more available to others. I still haven't, the jury's still out on that. I know that for some people, actually driving in their car is a great way to settle and unwind. If I know it's keeping my kitchen a little bit cleaner, because when I Zoom, I'm sitting at the kitchen table, so I have to clean up the background. So, there's some collateral benefit in that, but I think the jury's still out. Lots of anecdotal information. I'm doing EMDR on Zoom, which I was surprised that was going to work. There's the if you're seeing the PowerPoint, there's some bibliography stuff. Would it be possible to show the slide with the app again? Yeah, it's a pretty cool resource. Let's just go back here. But if you type in Provider Resilience in the Google Store, it's and I'm always into scores, so you can try to have your average score improve, right? So hopefully that'll help. Is Sierra Tucson in operation? Yes, we are in operation. We have this whole COVID screening process. If someone is at risk, they're either in isolation or in quarantine. If they're in that situation, we're doing Zoom sessions. One thing I'm noticing here is that people feel really safe because it is contained. So instead of this background coronavirus, filling up their psychic container, they're able to kind of not really think about that. So instead of focusing on what's going on in the moment, we are still able to do, the regressive therapy and really focus on childhood trauma and things that have disrupted their nervous system. So, it's and mental health doesn't stop because people are secluding in place. I think that's incredibly activating. I know going into a grocery store is pretty weird, right? It's not a pleasurable experience. So it's changing how we operate. I saw this little girl the other day with pink shoes, pink dress, pink shirt, and a pink mask. So I'm at 9 o'clock. We're still admitting. I'm just seeing how can one compartmentalize, and is that a good option? Great question. Well, I compartmentalize during the day, but then I pull it out. And so I have people in my life who I can go to download. Sometimes I'll say, so I'll get my little trauma button hit, and I'm going to put it in this drawer over here. I'm not going to lock it, but I'm going to pull it out later. So I think short term, but we all know that compartmentalization works up to a certain point. Thank you very much. I know I may be doing this as a more in-depth presentation where we can actually go in and practice some of these self-care skills. Peter Levine talks a little about orientation, some of these self-hug strategies, anything we can do to decrease activation in ourselves, super important. Big fan. I know another colleague she schedules her clients not on the hour, but she gives herself an hour and 15 minutes so that she can practice self-care 15 minutes between each client. So that's another option. I know that's sometimes not available to all of us, but our work is super important right now. Lots of people out there struggling, and we have this awesome opportunity to be, a positive influence on people's lives. And thank you for showing up. Have a great day.